Sports Medicine Associates decided to look into the use of CBD treatment for the management of chronic pain, mainly out of the demand from our patients. Our patients come to us with some chronic conditions that are orthopedic in nature that we just cannot fix. There's a surgery that cannot fix it, or some things are as good as they can be. So we seek to manage some of these chronic pains and ailments long term. And we certainly try to do it without pain-relieving medications such as codeine, and we try to limit the use of anti-inflammatories because certainly anti-inflammatories have been prone to give kidney disease, liver issues, and GI symptoms. Patients were coming to us over the last few years with an increased usage of CBD. And from the physicians within Sports Medicine Associates, we started to discuss this. And patients had different experiences with it. Well, as we looked into it, we started to see that there was just multiple outlets on where you can buy CBD, and we weren't sure of what people were actually buying, but we knew that there was a demand there for them to buy it. And we wanted to make sure that if people were going to do this for the first time ever, Sports Medicine Associates was going to look to provide an answer to that demand. So we partnered with a pharmacy over the last year, and we have diligently worked with them to produce an absolute pure broad spectrum CBD oil cream. So therefore we know if we are giving it to our patients, we know they're getting exactly what they're buying for. And we looked at the customer service aspect of it, the deliverance of it, the product and everything of what it is, and on the back side of it there's a QR code. So anyone that purchases it can scan the QR code and it'll automatically link you to a website and tell you everything that's in that bottle. And since our name is on it, we stand by that. And again, the goal is to try to help our patients manage these chronic orthopedic aches and pains and ailments. Well, at this point in my life, my right knee it's not perfect anymore. And if money and different things could make it feel better, it would feel better. But it doesn't. And there's a part of it that's never going to be the same. But I can manage it. So CBD for me has been allowing me to manage the discomfort in my knee. I apply it twice a day, once in the morning, once through midday. Do I think it's a miracle? Does it make my knee feel like I'm 20 years old? No, it doesn't. But what it does do is it allows me to function pretty comfortably. And fortunately, I'm still able to do the things that I want to do. I tend to work out 3 to 5 times a week. I cycle close to 100 miles a week still. I do yoga, I lift weights, and things hurt. It just happens as we get older. Things like CBD allow me to manage some of that chronic discomfort and allow me to be functional, but I'm not taking anti-inflammatories or codeine, and I'm not limiting my life. And so we tell people this is the science that we look at, and this is the science behind it, and this is how it works. Does it work for you or not? There's only one way to find out. But if you're going to purchase it, we want you to purchase something that we can stand behind 100% and say you are getting 100% broad spectrum CBD, and we stand behind that.